Good morning, everybody. So I'm going to talk to you today about a piece of work that we did at the ESRI that was funded by our research programme by the EPA. And this is a piece of policy evaluation, so looking, I suppose, at the impacts of an environmental policy that's been put in place. And I suppose this is a core piece, that sort of speaks to the mission of what the ESRI does. We provide evidence for policy. And a really important part of policy evaluation is, sort of looking back at existing policies and seeing, whether they're achieving their objectives, but also in a way looking forward and thinking about how we can tweak existing policies. So what I'm going to talk to you today is about the Smoky coal ban and the solid fuel regulations, and specifically about an evaluation about how those solid fuel regulations, particularly in the period 2010 to 2018, impacted on the older population and their health and mortality. Okay, so a lot of the speakers already this morning have very eloquently sort of explained the broader context for why air pollution in particular is a threat to human health. But we know from multiple agencies that it's recognised as a major risk factor for disease and premature mortality. And the evidence base for this finding is really growing, and it's growing all of the time. It's associated with a wide range of diseases, in particular cardiovascular and respiratory disease. But as Ian mentioned this morning, there's really good emerging evidence now for effects of air pollution on sort of multiple organs of the body, including the brain and dementia and cognitive impairment. Again, as has been mentioned this morning, there are big inequalities both in terms of people's exposure to air pollution. So people in more disadvantaged situations, for example, tend to live in areas that have higher levels of air pollution. But they're also, by virtue of other characteristics of their lives, for example, their housing situation, the fact that they may have other health conditions, they're more vulnerable to the negative impacts of the air pollution that they experience. And a couple of population groups that are particularly vulnerable are children and older people, and I'm going to focus on the older population today. And this sort of growing evidence base has been reflected in ever-decreasing guidelines and regulatory limits in relation to key air pollutants. There is particular concern over these very fine particles and PM2.5, which can penetrate deep into the respiratory tract and also, in some cases, can sort of pass over the blood barrier, and that's where you potentially see impacts on other organs of the body. In Ireland, the main source is burning of solid fuels for heating, so coal, peat and wood. And in Ireland, on the basis of data from the last census in 2022, we were asked how we heat our homes for heating, and 7.2% of households said that they used solid fuels as their main source of heating. So that proportion has been declining over time, but it's still substantial. But there has been work that's been done by other researchers at UCC, funded by the EPA, that's shown that actually a lot of people will use solid fuels as a sort of a secondary heating source. So the actual prevalence of use of solid fuels is actually higher than the census data would suggest. So I suppose the context for the policy that we're evaluating here is what's sort of colloquially known as the Smoky coal ban, or the solid fuel regulations. And I suppose the starting point for this was serious concerns over air quality in Dublin in the 1980s. So the magazine cover on your right there is from In Dublin magazine. I think it's around 1983 or 1984. And it shows, this sort of haze of smog over Dublin city, and makes a play on the Dirty Old Town song that the Pogues were releasing in the 1980s. So that led to the first Smoky coal ban that was enacted and implemented in the Dublin area in 1990. And it was progressively extended to other areas of the country over time. And there was a bit of work that was done, and very impactful work that was done first on the 1990 Dublin ban, and then subsequent bans. So 1993 Cork was included, and then 1995 some other big urban areas. So the first paper here on the left is this really well-known paper by Luke Clancy and colleagues, which showed sort of immediate reductions in air pollution and improvements then in terms of mortality from cardiovascular and respiratory disease. And then there was subsequent work as well, looking not just at mortality, but also what Ian was talking about, morbidity, so looking at hospital admissions for respiratory and cardiovascular disease, and taking into account some of the later bans, as I mentioned, in Cork and some of the other urban areas. But really, there's been nothing more recent that's been evaluating the sort of further rollout of the smoky coal ban. And as I'll talk about at the end, these regulations were extended nationwide in October 2022. We are not evaluating what's happened since then, but I'll talk a little bit about that at the end. So the way we're conducting this research is we are evaluating the impact of the smoky coal ban, and we're focusing on towns because these are the areas that were progressively included in the solid fuel regulations through the 2000s. And I'll explain the sort of towns and the reasoning behind the regulations in a moment. As I mentioned, we're not evaluating the sort of post-2022 solid fuel regulations, but perhaps we can talk about that in the question and answer session. And we use data from two main sources to do this. So first of all, obviously, we needed data on what areas were covered and what were the implementation dates for the various solid fuel regulations. So we got those from the Department of the Environment. And we're looking specifically at that period, 2011 to 2015, to line up with data that we have on health and well-being and mortality from the Irish Longitudinal Study on Ageing, which is this nationally representative survey of the older population in Ireland. And crucially, what we have here is we've got really nice variation in both the timing and the coverage in terms of the spatial coverage of the bans that allows us to get at the sort of causal impact of the smoky coal bans on respiratory disease and mortality. So this allows us to kind of strip away other things that might be happening and to identify like control and treatment groups. So, as I mentioned, the smoky coal ban started in Dublin in 1990, and you can see here how they were extended over time. So really what we are interested in is the 2011 to 2015 changes, and these are where they progressively extended the ban to different towns depending on their population size. So by 2011, all towns with a population greater than 15,000 inhabitants were covered, and by 2020, all towns with a population of greater than 10,000 were covered. So progressively, more and more towns were being covered by the bans over this period. Just a quick mention of the Irish Longitudinal Study on Ageing. As I mentioned, it's a nationally representative survey of the over 50s population in Ireland, which started around 2010, and people are followed up on average about every 2 years afterwards. So it follows the same cohort of people through time. It collects really detailed health, social, economic data on individuals, so it captures multiple sort of dimensions of their lives. And crucially, what it contains is information on where people live. So we use this to identify where they were living and whether they were subject to smoky coal bans when they were surveyed in each of the waves of the survey. So this is what TILDA looks like. So you'll see here across the bottom, these are what we call the waves of data collection, the years in which they're collected. You don't really have to worry about the grey boxes. These are just the way in which the data was collected, whether it was an interview, it was a health assessment, or a self-completion questionnaire, and you can see the sample sizes there. Interestingly, and we don't use this data, in 2010, or 2020, they recruited a new cohort of people over the age of 50 to refresh the sample so that it's continually representative of people over the age of 50. So the data that we use are from the first 5 waves, but obviously there's potential to extend this as further waves of the data become available to researchers. So we look at people who are in all of those first 5 waves of TILDA from 2010 to 2018. And as I mentioned, we have that nice temporal and spatial variability in people's exposure to the smoky coal bans. So you can see here, this is just, I suppose, the information on where people are in terms of their variation to the smoky coal bans. And essentially, we're really interested in people in 2011 and 2012, 13 and 15 and their extensions, because that's where you get this variation over time that we can use to identify this effect. So we're looking at 2 outcomes, chronic lung disease and all-cause mortality. At the time we were conducting this, we didn't have information on cause-specific mortality, and I think that's something that we would like to extend this piece of work to do. So in TILDA, people are asked, has a doctor ever told you that you've been diagnosed with different conditions? A list of 14 are given to them, and one of them is chronic lung disease, or they're sort of given further information as to what that might constitute. We also control for other things that might be happening in these areas and over time as well. Obviously, smoking is a big risk factor for respiratory disease. There may also be other factors, for example, where you grew up. Did you grow up in an urban area, a rural area? Your socioeconomic status or position, whether you'd lived away from Ireland or lived away from the area that you were surveyed in. So to sort of give you a broad highlight of the findings, we find significant, so statistically significant effects of the smoky coal ban in that it reduces the incidence of respiratory disease in the older population. The effect size is about 1 to 2 percentage points. That might seem low, but when you think about the overall prevalence of lung disease, that's quite a large effect. So between 4 and 5% of the population, of this population, reported lung disease over this period. There are variation in the estimates, and that really reflects how we define our control and treatment groups. So, for example, do we include Dublin in the control group, or do we not include Dublin, given that they've been subject to the ban for 30-odd years? We didn't detect any effect on all-cause mortality. I suppose one of the potential reasons for this is that we have a relatively short follow-up period of 8 years, and we were also looking at all-cause mortality. So it includes, all types of causes of death, not just, for example, respiratory or cardiovascular, which are mainly indicated in terms of PM 2.5 exposure. There's the usual researcher caveats with this. Because we look at TILDA participants from the age of 50, we don't really know what they were doing or what their exposure was prior to the age of 50. So, for example, we don't know if people who were in the non-zoned towns, for example, whether they had poorer health or they may have had premature mortality and just weren't being included in the TILDA survey, so we may be underestimating the effects. And we've no information on their sort of prior exposure to air pollution, for example, through childhood. We do control for where they grew up, but it doesn't get at exact levels. So with a minute and a half, I just wanted to make some final points around the sort of broader policy context and where we might take this piece of research. So Ellen, in her talk earlier, mentioned the Clean Air Strategy, which was published in 2023. And as part of that, there's an annual progress report, which is published, looking at progress in the various actions under the Clean Air Strategy and thinking about what sorts of initiatives might be put in place. And one of the things that they stress in the 2025 progress report is to review the impact of the 2022 solid fuel regulations. So as I mentioned, in October 2022, the regulations were extended nationwide, and they were also extended to include peat and wet wood. So this type of analysis could be extended to monitor the sort of ongoing implementation of the ban, of the regulations and the health impacts, including cause-specific mortality. And again, on a positive note, the EPA data and recent EPA data do show an improvement in air quality levels in Ireland over time, but it will be a challenge to achieve the new ELU limits by 2030, and then obviously the lower WHO guideline levels by 2040. So this does require continued enforcement of the regulations, but then also sort of broader policy measures in home retrofitting, for example, will be required to ensure continued progress. So I will leave it there. Thank you.